Welcome to Detox Living, where we bring you tips, truths, and testimonials to power your toxic-free living. I'm Coach Gessie, fibroid survivor turned health activist and founder of the DETOX Now, a holistic health platform that provides education and supplements to combat chronic disease, obesity, reproductive health issues, and lower life expectancy rates. Those things. So joining me tonight is Dr. P, and here he is. Woo, yes. Hi.
Hey, what's
Hey,
happening?
it's live today. I got you today.
I'm here.
Woo, last week I was saying to the people, well, last week he couldn't join us because he was doing just what he does, slay fibroids. So thank
Pretty
you.
much. No
Pretty
problem.
much.
Thank you. Thank you for having me.
Listen, first of all, I just want to shout out the nonprofit work that Dr. P does. You want to just quickly tell them about that before we go into our conversation, because y'all are actually fundraising right now for an important mentorship program.
So, Pulse of Perseverance is a journey that me and my brothers, two doctors that we met each other, my brothers for life, we met each other at undergrad, pushed each other to become physicians. We wrote a book chronicling our lives and our journey as Black men is not only getting to success, but what it's like in these hospitals, in these spaces where we are the minority. From the book sales, we hit major platforms, Today Show, ABC World News. Every dollar that we took from book sales and donations, we've given it back 100% to scholarships. We've given away monthly scholarships since September of 2018. Give
Love
a
that.
thousand dollars up, this $1,000 a month. Our next venture now is even more important work is a mentoring app where we're revolutionizing mentorship, making it so that these young kids have the access to people and spaces, doctors, lawyers, engineers, talent agents, you name it. We've met pilots, we've met Black excellence all over the country, and putting them all in one space at the touch of the
That's
hand
awesome.
for these kids to reach out and talk to. So please donate to a cause. I mean, if there's nothing else to donate to, you got to donate to our future. We can't talk about healthcare disparities.
That's right.
Can't talk about all of these things that are happening with our kids and not being in the mix and being less than 5% in every professional realm and complaining about it, but not doing anything about it. So we know what it takes to get these kids there and change the narrative, and shift the culture. And that's what we're trying to do. So
I love that.
if you can donate, Pulse of P3, PULSE of P3.org /events. We would love and help and thank. And you can follow us too and see the work that we're doing all over the country, mentoring and speaking to kids and what we're providing for our future generations. But
And it's in
thank
the
you.
link in your bio too, because
It
that's
is.
how I donated. It's in
Absolutely.
the link in his bio of his page, which hopefully you're definitely following him. Because like you said, we have to put our dollars where our what we
Absolutely.
say we profess, right? We say we want to be the leaders of the industries, because we have the power to be so, because of who we are. I mean, we have the brilliance. It's just that we need the access, we need the support, we need the mentorship, and that allows us to, if you can see it, you can be it, right? But then also
Absolutely.
not just see it, but then actually touch it, right? Because
Absolutely.
that's what this
That's what you
does.
got to do.
It gives you,
You can see it all day long, but you got to really be able to, talk to people and understand. There's so many things. I was blessed by just working hard and just never refusing to accept failure for an answer. And I was blessed to get through it, but so many of our kids really can't get through it just because they can't get over these hurdles and obstacles that are put there purposely to keep us marginalized. So
purposely,
that's
that part,
yeah, that's
purposely.
what we're trying to do. We're trying to show kids the way and just put them. Everybody doesn't want to be a doctor.
Hmm.
We're not pushing people to be doctors.
Right.
Everybody don't want to be a lawyer. Like we're trying to get kids to find. That's what the app is designed to do. Number one, expose them to all of the things that they don't even know about. You know, you want to play professional basketball, but what about the agents? What about the
Yep. What
managers? What
about
about the
all of
people
the
that are making
other
the money?
revenue
Right,
streams in that
right,
business, in that
absolutely.
industry?
And so
Hmm.
we opening that, you know, opening their minds to that, and not only opening their minds to those things, but also putting them with a mentor that's already in those spaces to, you know, to be able to help them. So the app is super dope, man.
That's
Of course, I'm
phenomenal.
biased, but
That's
it's
where the
super,
rubber
super
meets
dope.
the road. That's where
Yeah,
the rubber meets the road. So I love it. So I'm glad that, we put that at the top, because if we don't put, what are we doing this for?
right.
Right? We're doing this for a better tomorrow. And we want to make a better today so that tomorrow looks better, right? So that when tomorrow comes, it's gonna be brighter, right?
Absolutely.
And it's definitely for, we have to be the cavalry, right? And that really is a good segue to what, why we're doing what we're doing, is that, somebody asked me, and I got this. I said, I'm gonna tee it up and give you this question first. They said, like, why partner now? What is it, this partnership? What is it that this partnership will provide your patients, right?
Yeah.
Because putting the power in your hands of what you can do. I said, hold on, I'm sorry, I'm putting the words. You tell them, Dr. B.
Yeah, I mean, so a partnership, you know, when I'm finished with surgery and when uh, you know, I'm done. Like, you know, the people ask like, well, what can you do to prevent? I'm pretty, I feel confidence about, you know, my work and the work that I do as far as recurrence and things are concerned. But, you know, it's not a perfect science, and really everything that happens in our life, no matter what it is, whether we go through cancers or any of many of the ailments that we go through, it has a lot to do with what we put in our bodies, from food to supplements and you know, things to stop chronic inflammation and those things. It's a way of life. It's a lifestyle. So, you know, my answer, you know, is typically, you know, just got to live healthier. But to have
And they
some
look at you
to
like,
right, like what? How do
huh?
I do that? So to be able to have somebody that can coach them through how to live healthier lives, how to, you know, l- put supplements that are going to matter in your body and put you know, healthier foods into your body, like it's, you know, that's what I felt the need for the partnership was, giving the next step as far as like
Right,
what now.
right.
So I think
A
that's
curated,
extremely important.
curated plan, a
Ab-
curated plan
Absolutely,
specifically designed for them.
absolutely.
Yeah, that's exciting for me, because, the first part, which I mentioned earlier, is some people feel like, well, what we always hear is some people say, like, okay, I don't want to have surgery. I'm like, okay, but wait a second. Do you need to consider it? Right? Like, I don't come, if you come to the table and you're like, this is what's happening. I'm like, okay, what is the doctor saying? Okay, let's look at this. And you've tried it. Some people are like, well, I want to try. I want to try to use everything I have at my disposal naturally. And they've had success. And some people, no. Some people don't have time working on their factor. Like, they may be trying, like you said, they have advanced concerns with fertility, or they're having severe complications. It's saying, you know what? I have options, and I have tools and support to do what's in my power to do. And part of that is also, for me, part of those options is connecting them to a doctor like you specifically, who I know is going to give them the real, right?
Yeah.
Because the question I got was, well, Coach Gessie, I thought you were preaching, holistic health, and what is this about? Why are you connecting us to surgeons? Sir, I've heard, what is it exactly? Oh, surgery is, why are you telling them to have surgery? I said, first of all, let's clear the narrative and the correct information here. I am not telling you to have surgery. I'm saying, if your situation, given all your concerns, right, you want the best recommendation for your case. Number one, I trust Dr. P. And I say this because I said to someone, if I was getting on the table tomorrow and I had fibroids in a scenario where I needed to have them removed, I would be calling Dr. P. Now, that's if I have a sister, that tells you everything you need to know. I have family who needs it because of whatever there's, maybe they just don't want to, they just don't want, they want to specifically deal with, they want to have surgery, or they're having complications that require, or they're trying to have a baby. First thing I say, listen, you know what? I need you to have a consultation with Dr. P, because then I know what the assessment is going to be real. And the assessment, he's not going to say, yeah, let's book you for surgery before even looking at you. He's not going to say, let's I can put you on my calendar, because he's trying to, fill up his calendar because it's already full.
Already. It is absolutely crazy. I got to start doing something because it's getting bananas.
Listen, we're not doing no AI replications, okay, Dr. P? No AI
Nah,
replications.
nah. And people will be like, oh, they'll ask me like, are you doing the surgery? I'm like,
Yes.
hell yeah. Like, what you mean?
What you
I
mean?
don't, I don't get on here and talk this shit and then let somebody do something crazy. Like if I'm gonna go down, it's on my own shield. I'm
Go
not
be on
like
my own.
I stand behind everything I say. Like I am who I
Right.
am.
And then the other thing they asked me was, okay, so are you saying that it's the first course, a first plan, the first strategy should, well, it depends, again, it depends on your case.
Yeah,
If you
it
have
depends.
hydronephrosis and your kidneys
Yeah.
are swollen because of the fibroid, that can cause future kidney damage. That
Mm,
can cause kidney damage right now.
yeah.
Yeah, you need to get that taken care of right away.
Yeah.
That's go. What is it? What do they say in Monopoly? Go directly to go, don't stop.
Don't pass go. Don't collect $200.
Right. Like you need to go straight, like straight,
Yeah, it's like I
right?
mean because unfortunately because of the lack of access to care,
Right.
uh, it hits our women um much harder. When I see us,
Right.
we have advanced fibroid
Right.
disease. A lot of women have advanced fibroid disease, and so you can't expect to change uh,
Yeah. In an instant.
years
What
and years of
took
something growing
years.
and what took years and
Right.
a few months. It just doesn't
Right.
happen that way. So it just we have to be very realistic about where we're at and
Right.
our circumstances. Like I tell women all the time, like sometimes you do have
Right.
time. You have time to see options and see things that are non-surgical.
Right.
I don't put surgeries on
Right.
anybody.
Right.
I give options. Every single person, I'm gonna give you option. Now, if you have fibroids that are coming up to your throat, then I'm like, listen, you can choose to live with this if you want to, but your options are very limited. But you
Right.
don't, you know,
Right.
if you don't want
You got
surgery, I'm
you
not the
got to
one
let
to
them
push it
know.
on you.
Right.
But with that being said, it's just like you have to make
Informed.
logical, informed,
Yeah.
and logical decisions about everything that you do.
Yeah. So that's a really important thing, right? So really informed. Like for our book and Fibroids Manual and Guide, we literally listed all the surgeries, all the medications, everything. Because what I found is when people are trying to find their options, they're becoming a research assistant. Okay,
Hmm.
Dr. P, in terms of trying to collect all of the white papers and all this, I'm like, okay, you know what? We put it in one place so you can have information, because something you just said was really critical, is that most when Black women have fibroids, we don't just have them in a higher percentage, we have them more symptomatic, right? We have
Right.
them with more complications, right? So the other thing we're trying to do is help stigmatize the idea of heavy periods from beginning, right? So that they don't end up with advanced fibroid disease, because they tackle it when you're at the hormonal imbalance stage, right? We're like, well,
Hmm.
wait a minute. My doctor's been, we had a client, she's been having heavy periods since she was 10. She missing school every month. Okay, Dr. P. And the doctor kept saying, you're okay. Then she told her to take, what was it?
Birth
Up to,
control pills.
yeah, no, not yet. That was later on. Before that, it was, you could take I think it was ibuprofen up to a certain amount just for the pain. And she was like, so to the point where she developed gut issues because of that, and just said, she just told her, you just bleed heavy. Finally, at 19, she found out she had fibroids, and then they
Hmm.
tried to put her on birth control pills. But here's the deal: is your body, right, is telling you something, and what we're looking to do is, I'm for the detox now. We want you to get educated to don't go past the heavy period. Like, don't go past it like it's not a major warning sign, right?
Right.
So, because prevention is cure, right? If we can do it from then. We can start making adjustments in diet, the nutrition plan, make adjustments in the supplements that you're taking, make adjustment in the stress management, which is huge because the chronic stress is a major upregulator of whatever you're dealing with, right? Then we've seen women not get to there, right? Reverse it. And even some women, by changing these things, not only their suffering was so crazy, they were on narcotic drugs for the pain.
Hmm.
They were changing pads every 20 to 30 minutes. And then on our protocol, in a month, complete change. At that point, you know what that does, Dr. P? That gives them time, if they're not suffering, like you
Hmm.
just said, to say, okay, wait a minute, my body's responding. Let me now allow to continue. One of the doctors said, continue doing what you're doing because whatever you're doing, you're making progress. But if you're not making progress, don't ignore that because your body's telling you you have other issues going on, right? So again, it's putting the education in your hands and equipping you with more laser information so that you can help empower yourself, advocate for yourself before things become complicated. And then when things are complicated, if they are complicated, you have the best resource in your toolkit. I was talking to somebody, I remember I was on a panel and it was like, what we said is that some surgeon, and I know you'll get this, for some surgeon, every fibroid, all he has is a hammer, and that hammer is a hysterectomy, right? For
Hmm.
some surgeon, the only thing they have is a vertical incision. That's all
Right.
they got. That's all they can bring to the table.
So somebody said, like, because I'm looking at
Yeah,
some of
yeah,
these
yeah.
comments, and it's like some of us are not trusting that doctors benefit their well-being, and I agree
That's
with
real.
you, right? So there are many physicians that are out here for the bottom line and for the dollar. And to that point, I try to educate people as much as I can about the profession as far as how you can really sift that out. When you look at anything else, you kind of look at the holistic part of what somebody's trying to tell you, what they're giving you, and then you make an educated assessment as far as like the information they give you, them as a person, and those things. Like when we look into medicine, we really just look at what they're telling us, and like you're not looking at the whole picture.
Hmm.
Like you have to look at who this person is, like who, like are they,
What are
if
some
you're
red
really,
flags for you?
yeah.
Maybe that would help them. Give them some
So
red flags. Like,
red flag, a couple of red flags. One red flag is that if someone is a you know a professional in some way, shape, or form, and they have social media platforms,
mhm.
it should reflect what they're passionate about, right?
Mm,
Don't be afraid to go to somebody. So what are they talking about? What is their social media like?
that's
What are
good.
they really talking
That's
about?
good.
So if they're talking about a bunch of nonsense, or are they even talking about things that are not against your or against your culture or against who you are, or
Hmm.
whatever, you gotta take that in
Take it
consideration.
into
Don't
consideration.
eliminate their social media platform. If they are, when they're talking to you, are they breaking things down? Are they answering your questions? Are they really listening to you,
Yeah.
and coming up with a plan that works for you? That both of you all can kind of have a conversation, because it's a mutualistic relationship. I should not be dictating to you what your treatments are. I should not be doing those things. Like when you hear me talk, like if it's things that can save you money like that, or to save you deductibles and save you things, like I'll go with that. Like I don't get a bunch of unnecessary labs, a bunch of unnecessary tests. Once I have the information, now I'm ready to present you with the information or what have you. Like, is your doctor really like being efficient
Mm.
and listening to you and open the conversation so that you can have input into your own care? Like these are the things. Like there's so many doctors I know, they'll, if they're sending you for serial ultrasounds, they're sending you to come back every week, do this, do that, or what have you, like take this blood draw, what have you. Like this is just revenue generators. This is revenue
Mm.
builders. It's stall tactics to put you back, in surgery or what have you.
Mm.
Like if you have a person that's more this more concentrated with revenue, you can see those things.
Yeah.
Like, but it's really about, and you could talk to, patient, like in the social media era that we're in, like if
Yeah.
somebody has a social media platform, like their patients are attached to
That's
that.
right.
Like,
Right.
see what their patients are talking about. Like, see,
That's such a good point because
and
you have
especially
access.
the patients that look like you,
Mm-hmm.
like that are in positions that you are, like they should be able to like highlight their patients, put their patients out there, not hiding them, putting their private pages up or whatever. Like all of that should be open books. Like I say that like you can do research behind the
It's true.
curtains to pick providers that make sense for you, and that's what we're not doing. Like, if you just looking at a straight Google review, you could pay
Oh,
for Google reviews.
oh my
If you're
God.
just looking at,
And they
now
don't
you look
take,
at,
they don't
right,
factor in ethnic concordance.
no,
Google
not at all,
reviews are not going to tell you how they treat Black and brown people.
not at
They're
all.
usually going to be, right? Just
Yeah,
going to be
whoever
talking
wants.
about, mostly it's going to be, nothing related to their cultural sensitivity. They're listening. So something that you said, it really struck me is that I always tell our clients that, remember, whenever you're going into a doctor's office, there are two experts in the room, right? You
Hmm.
are the expert on yourself.
Of your body,
Hmm.
absolutely.
And the physician is the doctor is the expert in their field, right?
Hmm.
So if they just diminish your expertise, that's not someone you want to spend
Yeah,
time with, right? Because
yeah,
they're not going to be listening to you, and you know your body the best. You know
yeah,
what's going on, right? If they're dismissing you, that is a number one
absolutely.
sign. That's a major red flag, right?
Yeah, and
That's
somebody says like most of us get the one size fits all approach. Absolutely.
yes.
If you feel that way, you don't be scared to get a second, third, fourth opinion. Don't be
Yep.
scared to just walk out and just say, okay, I'm not going to just do what you're saying. Like,
Absolutely.
if you feel that way, listen to your inner self. Like if your
Absolutely.
inner self saying something is wrong, like, you know, pivot,
Absolutely.
keep
And this
looking.
is that for me is why I also am excited about this partnership, because I know you do telehealth, right? So no matter
Yeah.
where, like one of our clients, your patient, my client, she was out of Philadelphia, and
Hmm.
she's going to be sharing her testimony soon, which is amazing,
Oh.
right? You removed the 100 and I think it was eight
Hmm.
fibroids,
Yeah,
and
she actually coming. She's coming this week.
that's right. She told me she's going to see
She's
you.
coming this week. Yeah.
That's right. And everybody told her hysterectomy was the only option, right?
Yeah.
And I looked at her, I said, listen, you know what? I would, we have our fibroids kit, and, I love our protocol, but you are not, you need to, an intervention now. This is
Hmm.
not something your timetable does not allow. We need to resolve this health issue now. It's
Right.
causing crisis now. And I asked her, I
Facts.
said, please make a consultation with Dr. P. Please. And she did, because
Yeah.
she trusted me. She knew if I said, listen, I'm not gonna just send you. And I know a lot of physicians, right? But I've never had a partnership with a surgeon before. This tells you a lot, y'all, that I trust this man enough to say, you know what? I want you to be the person who I refer my clients to give them a real recommendation and review of what's going on with their case, and
Yeah.
to support and be, to guide and be their physician, be their surgeon if they need it, right?
Yeah.
Because, like, the biggest thing is, the reason why it's so important is because you said it at the top. Advanced situations are, so many of us find ourselves in advanced situations because of all of the inequities from before, because of all the
Facts.
disparities of not being listened to, of being told, that, or scared, because all they say to you, like, I've had so many clients young, and they just say to them, oh, you need a hysterectomy. 30
Yeah.
something years old. Never, you haven't even one, he hadn't even examined her. Oh, you need a hysterectomy.
Great.
And they're like, I'm running from this.
So yeah, I'm just reading these conversations like that. I get 15 minutes with my primary. I mean, that's just to be just total honest about it. There is a balance into it.
Mm-hmm.
I can't. I will defend doctors to a point of where you have to look at it like, anybody's work. Like you have to be efficient. You
Mm-hmm.
have to be, you have to maximize things, right? So the insurance companies are really what ruin medicine if you really want to get to it. Like, they pay pennies on the dollars for these visits or whatever, and there's pressure in most realms for doctors to
Right.
have to produce. Like,
Certain number.
if you spend hours and hours with people, and now you've seen 5 people as opposed to 10 people or 15 people,
Right.
right? Like they frown upon that because it does impact the bottom line.
Right.
But with that being said, too, it's also a thing about care, just the doing the right thing. I have been, I guess, blessed and cursed with always doing the right thing.
Hmm.
So I don't care. Like I will never let anybody leave out of my room with questions, concerns, or whatever. I don't care if it takes 30 minutes, hour, it doesn't matter. And with that, people, like I will say, understand that, right? That the same care and time that you want your doctor to take with you, realize he's doing that for somebody else. So if he's late to talk to you or
Yeah.
he's
Be
late to be
patient.
with you, he's
Mhm.
doing that with someone else too. So like you have to be considerate because we can't have it both ways.
Right.
We can't have it say
I
he's
don't. I
microwaving
want
me and
don't
I
don't
want,
don't get
but
past
with
that
me,
15 minutes.
right? But with me, you got to answer all these questions. I don't care about them, but like you answer me
Right.
45 minutes,
Right.
but with everybody else, you have
Right.
50. Like so, be
Right.
considerate and understand because like I've been blessed uh that God has blessed me to be able to do things that I want to do to take care of my patients
Hmm.
the way that I want to take care of
Hmm.
them, to not
Autonomy
have to
to follow your
micromanage them.
value system.
I've been blessed to be able to do that. So I'm able to take more time and do the things that I do just because I'm in that position to do that. All physicians are not
That's
able
true.
to do that.
That's true.
But with that being said, like you have to be courteous. Like when the extra is being given to you, when people are sacrificing for you,
Yeah.
that you have to realize they have to do that for
Other
every
people.
single person. So
Mhm.
just be cognizant of that. Because
Yeah.
I man,
Factor that in. Factor that
you
in. That's true.
you be surprised. Like some of these people, like what? It's like because like it was like all right, the consultation fee. I can't pay all that. All right, so you pay a consultation fee, and then so you know book you for surgery, and then I help you get here, and then when you get here post op, I'm calling you. I stop by hotels. I
Yeah.
stop
No.
by
No. No. No.
like
No. The
I just stop
dedication
by
is
my vacation.
real.
Like I
The
literally just stop
dedication
by.
is
Yeah,
real.
I go by. I'm hands on with everything. People got my cell phone numbers. They got my email addresses. They got my DM. You have pretty much access to me all the
And then
time. So it's
it
like you got to look at
changes.
the big picture,
Don't call
right?
him after that. It changes.
Yeah. No, I don't. I'm just super cool. Like I always just have to do the right thing. Like I treat
I,
everybody
and
like
that's
family, man.
everything. No, that's everything. But understand there is a take. There's a give and take. Just like if
Yeah.
we want that support, then we have to be willing. Like I have been in those doctors' offices for hours. For let's say I have I have an ophthalmologist because of my eye doctor, and it's not. It is like I'm every time I'm there for an hour and a half. So I don't know. I guess I've learned to be patient. But anyway, next question. So someone said they said my mother had a hysterectomy because of fibroids that were the size of a grapefruit. I desperately want to prevent that, but all they want to do is butcher me. Book a consultation with Dr. P.
Yeah.
Start there. I put his website I pinned it at the bottom. I also encourage you to take our quiz so that you can also, that's the other thing is you need a tribe. This is where I was going. You need a tribe. You're not gonna be able to sit in the doctor's office for hours. Okay.
Right.
He can't literally do every single thing. That's why you have to have a support system,
Thanks.
right? That is why we do what we do, so that you have a support system that will help like navigate this whole situation for you. Okay. Because I've had my own gastro doctor say, I said, so what should I be eating right now? He says, well, you know better than me. He said, they didn't teach me that in med school. I was, he said, he was honest. He was honest.
Uh,
He was like, I'm going to be honest. That's not what they teach us. I said, okay.
so somebody was like,
Listen.
somebody lives in New York City, you don't want surgery, won't have it. Like I can't tell you if you need surgery
Right.
now, you from other cities, but I will say this, and I'll say this to my patients, people on my page or what have you. You can't let your location or your region dictate your care, right?
That's right.
You do things In every other realm, you will fly, you will do anything, whatever. If it was something cosmetic, you would fly. If it was something that, you know, you really wanted, if it was something like a possession, like a car or something that you really wanted, and it was only one in Texas, you go down there and get that car in Texas, like, and go get it, whatever, if you didn't have it in your space. So to that end, I'm not saying I'm the only person, but there are gynecologic deserts. I will tell you that right now. New York
Yeah.
is one of them, and that's
Mm.
real. You know, I've had patients. If I had a dollar for every patient that I have fly in from New York or LA, I would be
Isn't that
well
crazy?
beyond my means.
I'm in New
But you know,
York.
so
It's
to that
minimally
end, you got
invasive
people.
surgery.
Right.
Yeah.
People come and say, "Well, do you have anybody in
I
New
got
York?" I don't. I'm
fertility
sorry, I
though.
don't.
I got a fertility
Yeah,
specialist.
they
Good
there,
one.
but as far as from like from surgery wise, you don't. So you can always utilize insurances to your benefit.
Mhm.
Like, you know, you can open enrollment is a beautiful thing.
It's coming up right now. Get that
Insurances make a
PPO.
whole bunch of money off of
Hmm.
us, right? So it's nothing for you to go into open enrollment, get your designer plan, right? That's
Yep.
going to allow you to travel, get a
Get a
PPO plan or whatever, and
PPO plan.
travel
Yep.
for your surgery,
And
right?
this is open enrollment season, November, coming up right around
So,
the corner. This is the
so just
time.
imagine if you want to do the math, right? If you got to pay another two, three, or even $400 per month for a PPO plan that allows you to travel. Now you've paid, you know, anywhere from $2,000 to $4,000 for the year, and you've gotten the surgery, the tens or twenties or 30, $40,000 surgery that you needed, you know, for fractions of a dollar. You know, but if you just say, "Hey, my insurance don't cover it, I can't do it," and you allow somebody to do something you don't want them to do, like, can't really say it's, you know, you don't have the opportunity to make a different change,
Mm,
and to do something for
that's
yourself.
great info. Two things that just come up. So someone said, is it possible to get a non-invasive procedure with large fibroid? I do not wish to be cut open if possible. With each birth, the fibroids have grown bigger. Not sure the current size. What do you think about the Acessa?
I
And
mean, Excessa, and that's somebody else that we need to see more Excessa. I am, you know, I'm a very big proponent of Excessa.
mhm,
You know, I teach Excessa all over the country. I've
mhm,
been utilizing it for years and years and years since it was in its inception phases. So there's a role for Excessa. Uh, Excessa is good for certain
certain,
patients. So you have to really see where you're at, as far as advanced fibroid disease and to where your fibroids are located to
right,
see if you're a
right.
candidate for Excessa.
And if scar
But yeah,
tissue
it's
has
an
blocked
option.
the way, right? If too much
Yeah,
scar tissue is blocked the
for
way.
when you say scar tissue, what do
Like
you mean
if the
for?
scar
I guess if I
tissue is basically giving you no point of clear like entry, if there's a lot of
even
scar
with
tissue that's
that being said, if
with
somebody's
or
had previous
with
surgery and
other organs, if it's like connecting it to other
it,
organs.
it you know, there's an art to what's called adhesiolysis, which is, you know, the
Mm-hmm.
removal of
Adhesions.
scar tissue adhesions. Like, there's an art to it. So just because you have scar tissue does not make you not a good candidate. I literally today, I swear to God, today I did a robotic surgery on a woman that she had two classical C-sections, so she had two surgeries where they cut up her belly to take her baby out, and
Wow.
she also had a vertical laparotomy for a myomectomy. So that's
Wow.
three vertical incision open abdominal surgeries, and she needed a hysterectomy. And so when I went in there, literally and she also had a large hernia that I had to deal with too. But her uterus was literally plastered to
Mm-hmm.
her anterior abdominal wall. Like, I mean, when I tell you dense, thick adhesions plastered up there, I hadn't
Wow.
even seen it. It was like some of the worst adhesions I've seen.
Mm.
But meticulously,
Adhesions is the scar tissue, y'all,
right,
inside.
right, the scar
Inside.
tissue on
That's
the
what it's
inside. So
called. Scar tissue inside from all the
from all
surgeries.
those surgeries, it's healing tissue, whatever, and it basically made her uterus stuck to the top of her wall. But I was able to take it down, move her uterus, minimally invasive. She's actually leaving today, same day surgery, not in pain, doing very
Mm.
well. Whereas, you know,
And
so many
you left her ovaries?
so many people, yeah, of course. So, so many people have what told her vertical incisions were the only way. you know, and she was going to go through a she had a womb breakdown previously. She had a whole bunch of different things that happened. So it's possible, but you have to have somebody that's skilled, that knows what they're doing,
Right.
that's not going to butcher you. Because I promise you, that's what I was saying on the show. It's like, you know, there are so many doctors out here that are just not good. And that's why some of these things are happening. You really have to do your research about people, because once you have a bad surgery, it changes your life. And
It
you're in
changes
trouble.
your life. I'm a
You're in trouble.
witness.
Yeah, you're in trouble. You're in
I
trouble.
have a
So
witness.
choose wisely.
Yeah. Okay. So, you know, someone says that as far as all the surgeries they've had, and if they had that adhesions procedure that you mentioned, like the removal of the scar tissue, what does that
Okay.
do in terms of how can more scar tissue come from that removal of the scar tissue?
Absolutely. So scar tissue isn't removed. It's called
Excised.
lysed, right?
Lice.
So if something, if two things are stuck together and you need to remove one thing, the scar tissue in between them, you basically have to kind of break that scar tissue up to
Right.
actually remove whatever it is you're trying to remove,
Mhm.
or to operate
But
on whatever you're trying to
what is
operate.
that? What is that? Is it burning it? Is it like
No, I mean,
slicing it?
it's dissecting. So
Dissecting.
when two tissue in of itself have planes, right? What we call planes, meaning their normal anatomy, their normal anatomical planes, right? When you breach or you compromise a plane of tissue from one organ, for instance, like if you fall down off your bike, or if you do anything and you cut your arm, it forms a scab, it weeps, it kind of has like a fluid that comes in it. The same thing happens in your belly. So when you make cuts, burns, or things or whatever, you form scabs on the inside of your belly.
That's right.
When you stand up, the bowel and everything, it comes together. So as it heals in those scabs, it's just basically scabs forming. Just imagine if you had a scab on your arm and you put some cotton on there and just
It's
let
gonna
the
stuck to
scab
it.
heal with the cotton. It's
It's
gonna
gonna
stick
get
to
stuck
it.
to it.
That's exactly what's happening to your belly. So anytime you're breaking that apart, you can formulate new scar tissue. So you never can really get rid of scar
Scar
tissue.
tissue.
You
Right.
can meticulously put things back together
Right.
again to decrease the incidence of scar tissue. But
Right.
you know, scar tissue, anytime you have surgery,
Yep.
unfortunately, is
It's a risk. It's a
a
lifetime risk.
side effect of it.
Yes.
But you have to make sure that the person is doing the damn surgery
Right.
understands tissue planes, to not burn excessively, to not cut excessively,
Right.
to be able
To
to respect things
minimize.
and put things back together appropriately,
Mm-hmm.
to minimize your scar
Right.
tissue. And if you do that, you don't have problems. But the problem is people just cut, they tear, they rip, they cut, they just go. They just trying to do whatever it is as quick as they can possibly, put it back together and send you on about your way. They don't care about your recovery. They don't care about what's happening on the healing on the inside of your belly after they're done. They don't care about none of that. They just want the job to be done, you to be safe, you to be alive, and go on about your
Right.
business. You need to be asking these questions about what a doctor's philosophy is as far as putting things back together again,
Right.
how they're trying to dissect your tissues, what's the plan, walk me through the surgery step by step, what are you trying to do? Like, you need to ask these questions, be
Yeah.
very detail oriented when you're talking to your doctors and you're
But you know,
choosing your surgeon.
but here's the thing. I'm gonna be real honest. They're not. How are they gonna be able to know how skilled they are? To be honest, unless they know someone who's been there. I mean, like.
So I'm gonna tell you why, right? There, you ask. Well, I try to teach folks. Listen, you ask very pertinent questions, right?
Laser
So
questions.
laser questions. These are questions that you ask. Hope you got a pen.
Mm-hmm.
If you're getting a laparoscopic surgery, ask your doctor how many times they've had to convert to an open surgery.
Very
Fair,
good
fair,
conversion.
fair
Very good
question.
conversion test.
Fair question. Fair question. Have you ever had to open to a open surgery?
What's
What's your complication rate? How many of your patients come back in with, injury? How many injuries have you
how
had?
are
How
you
many
gonna know that they're
urinary?
saying the truth though? Like, you see what I'm saying?
You can tell somebody lying, because they'll be like, well, these are things that can happen. They lying right there. If I sit up here and
If
say,
they start to, if they don't, if it doesn't roll off their tongue, like.
if it doesn't roll off your tongue, and they kind of say
But
like,
they
you
could
asked me
also
what my
be a good liar. I'm saying
it's hard.
they could be a
It's hard to be
good
a good liar.
liar.
It's hard because you want to know
Hard.
why.
That's my point.
You want to know why? Because they don't get that question. They don't get these questions to ask specifically about their surgical technique, about the
What
complication. You don't get that
how
from
about
patients.
what is the technique? What do you do specifically? Say, what do you do to
Yeah,
minimize scar tissue? So
absolutely.
tell them,
Phenomenal question.
ask. So what's the
Phenomenal question.
answer? What answer should they look for?
Say so my answer, and I can't tell you all the answers, but my answer is this. And if someone asks me that, I'll say I meticulously dissect things and don't overcut, don't overburn. I respect tissue planes so that things separate normally and keep their anatomic structure as much as possible. In addition to that, I put things back together appropriately, right? I
Mm-hmm.
put your peritoneum back together, I put your muscle back together, I put your fascia back together. There's no tissue layer that I don't put back together in its normal anatomical
Layer by layer,
version, layer
layer
by
by
layer.
layer.
That's what I do. And so, with that being said, things don't get stuck together because I'm very respectful of your normal anatomy and restoring that anatomy as I close and do my
Right,
surgeries. That is an answer when somebody is saying, I am serious and laser focused about how you're healing and how's it
right.
going. If they can't give you an
Now,
answer that's meticulous, then that's like, have questions.
right. So there, I see people, with questions and questions. Number one, this is why my team, who is referring you to Dr. P and all that, we do free group consultations on a weekly basis to answer your questions, to tell you, okay, if this is what you need to do, then you need to meet with Dr. P, like to answer your questions. I can tell you that. If you already know you want surgery, go ahead and make a consultation. His website is linked right there at the link in our bio. Because someone said, okay, you know what? I have a question for you. I have had a myomectomy in 2003. I got pregnant with my son in 2004, had a C-section now at age 47. My fibroids are back and full grown. Should I get another myomectomy even though I don't want any more children, or should I get a partial hysterectomy? I do have a PPO insurance, so I can come and get and have the surgery performed where you are. Number one, I'm gonna turn it over to you, but I gotta start with, just because you don't want to have children anymore is not a reason to get a hysterectomy,
Facts.
because there's so many things, number one, that keeping your uterus does for your body. All right, number one. Number two, because that's a bad thing that people are just spreading out there. Oh, you don't want any more kids? Get a hysterectomy. Like, it doesn't have other functions in your body. Number two is, remember, before you just say, hey, I just want to have a surgery, count the cost. Like, if you need a surgery and you want a surgery, absolutely schedule a consultation with Dr. P. You have a PPO, even better. Just count all the costs, because understand that what he said earlier. And again, I'm about to toss to you. Do you need surgery, or do you need lifestyle change? Because lifestyle, or do you need both? You always need lifestyle change. Do you want to make sure you do that and the surgery? Because if you don't, that's going to manifest in other ways anyway. Okay. So shortcut is, you need to do both.
Yeah. So I mean, with that being said, I concur. Like it really everybody's situation is different. Hysterectomy may not be the answer for you. It may be an option. It just really depends on what you're going through and what your desires are.
Yeah.
I have women that come in and say, "Listen, I've been suffering from bleeding and pain, and I can't, tolerate it anymore. I'm having a significant quality of life issue, and I don't want to deal with this issue anymore." So if that is the case, then all options need to be put on. But if you don't have those things or whatever, and there's stuff that you would rather to explore to see if it helps you with your symptoms, you can do that too. Everybody's different. There's not
Everybody.
one answer for any particular person. There are women with 10, 12, 13, 14 centimeter fibroids that have absolutely no symptoms, have normal periods, have no problems or what have you. Do they need surgery? Absolutely not. If they don't want surgery, they don't need it, right?
Mm-hmm.
There's women that have 2 centimeter fibroids that are sitting in the cavity of their uterus that are
And it
having
is.
the
They're
time from
hemorrhaging.
hell,
They're
the hemorrhaging
hemorrhaging.
time from hell,
Yeah.
and they may need surgery. But so it's really all
Case
about
by
the person
case.
and case by case of
Mm-hmm.
what's happening with you. And again, I don't just sell myself. I put myself out here just so I can be educational. I'm not trying to just like beat over the people over the
Yeah,
head with
no,
money.
he's not.
I
But
got
I'm telling
multiple
you,
I
the
got
needs is
multiple
him.
multiple patients. So you see patients, um and scales, HR advice. Now, like these are my patients that are in here. So if I was lying, I'm dying. Like
They
they're
be
in
telling you
here,
right
and
now.
they would be telling on me. So
They be pulling
when
that
we
carpet. They be telling on you right now.
absolutely,
But I'm going to say, I have spoken to a lot. I have met with, I have spoken to and worked with a lot of GYNs. And I'm going to tell you, Dr. P is one of one. I'm saying it because I believe it. Okay. I believe it. I haven't seen this kind of dedication and precision. I haven't seen this kind of just honesty, right? So, but and in all of that, I still say, remember, the very best thing is to never be cut. Like that's the best thing ever.
facts, facts.
Facts, okay?
And
Because
I don't want to, honestly.
you know,
If I don't have to, if
and
I can do it without surgery,
yeah,
absolutely.
and guess
Um,
what? If even if with the best meticulous care, what you can't avoid is that once you're cut, your body has to create scar tissue in
facts.
order to heal, right? And
Oh,
that
here
is
we go.
something. Yeah,
Here we
I
go.
know I'm about to bring up that question. I saw it.
I
And
see
your body
it.
has to create scar tissue in order to do that. And that means that's something you will have to manage around. I have to manage around it every day of my life. That's why I have an anti-inflammatory protocol, all of that, because I am the last surgery I had was 2019, and that's well the last abdominal surgery, and that's the last one I ever want to have. So that being the case, understand if you have never had a surgery, I definitely advise you to explore, you know, what you can do to help your body. If you have had a surgery, if Dr. P operated on you, please allow us to help you to help your body to prevent any future complications and more fibroids, because a healthy and anti-inflammatory lifestyle protocol is going to help you. Now let's get to
Facts.
the question that I know you saw and I saw.
That's it.
Go
So Ellie
ahead.
said, "What, Dr. P? What do you think about UFE procedure?"
Bing,
All right. So
bing.
let me go again.
Let's start with it's not a silver
Listen,
bullet. Stop lying to
listen,
people.
listen. So this is
Oh,
from me, okay? And again, this is one of those things where people
it's
honestly
the
are
tea.
not. They're not. They really don't care about. It's a procedure. Let me back up.
Yeah,
It is a
slow down.
procedure.
Back up. Back
Let me
up.
tell you what it is, right? So UFE for everybody that wants to know. Uterine fibroid embolization, UFE, UAE, same thing.
It's the
Both are the same
same
thing.
procedure.
Synonymous things.
Mhm.
It is a procedure in which an interventional radiologist, not a
I've had it.
gynecologist, but an interventional radiologist basically maps out the blood vessels to your fibroids through a scan,
Mhm.
right? And with that scan, they take a little catheter, they go through either blood vessels in your groin or in your arm, and they course it down, and they go to the small blood vessels that are to those fibroids, and they put an agent that basically blocks that blood vessel off, right?
Particles. They're
Now,
spheres.
mind you,
Spheres.
yeah, exactly.
Hmm.
So mind you, some women, I have not been to a woman yet that I've seen an ultrasound or MRI where they say what her fibroids are, and then I operate and they have those number of fibroids. That's number one. Number two, you can have 30, 40, 50, 60 fibroids. So you cutting off blood vessels for 30, 40, 50, 60 fibroids. I don't think so. It's not how it happens.
Mm-mm.
But to this point, I will start off by saying my mama, my sister, my auntie, my cousin, my friend, any woman that I know and have reach of, absolutely not. I will
Say it
tell you
again.
to the heavens, don't do it.
Don't
Right?
do it.
The reason being is because I don't agree with the procedure. And the reason why is because when you cut off the blood supply to any living tissue,
Gonna
it
die.
causes something called ischemic necrosis,
Necrosis.
right? Ischemic necrosis is painful. Now, mind you, I see women that have had UFEs all over. Have I had success stories with UFEs? And people say, "Hey, I had a UFE, I feel great." Yes, I will tell
But
you. I
how
will not say
long?
that
How
every.
long
I
did
will
it feel
not.
great?
Sometimes, I mean, I don't even follow them. I would just say to that point, I
Okay.
would say, listen, I've had, if you give me 100 women, I would say maybe 4 or 5 of them may say, "Hey, I had a UFE, it was great, no problems." But for me, the overwhelming majority of women that have had UAEs or UFEs have chronic pain, bleeding, and issues, and they come back to me for me to operate and do things with. And that's why I am not a proponent,
Mhm.
because again, if you sit on your hands right now, you go try when you go to on the toilet, put your hands, sit on your hands, do that for 5-10 minutes. Hands will start
Yeah.
tingling. That's because you have no blood
No blood
supply going to your
supply.
fingertips,
Uh-huh.
right? When you get off of your hands, the blood supply comes back, you start to feel the feeling back, that tingling goes away. Imagine you doing that to a tissue inside of your body,
Mhm.
cut the blood supply off, and now you're not getting that blood supply back. So
Yeah.
if that pain will be chronic.
Yep.
It doesn't happen to everybody. It depends on how extensive your fibroid disease is, how much of the blood supply they compromise, all of those things. But you're trusting that somebody cutting off the blood supply to your fibroids is going to just be productive, and you don't have all of this pain. I see it too many times, too many women that have chronic pain, have chronic issues. I don't recommend it. I'm straight. I'm not telling anybody in my family. If you do it and it worked for you, great. But if anybody comes on my page like, oh, I did it, you should do it too, it's not for everybody. I promise you. And I'm telling you, I wouldn't recommend
Nope.
it to my family. That's what you need to listen to.
Nope.
Ask a doctor, would you tell your mama to do
Eh.
that? And if they say no, I wouldn't, you need to really rethink it. And I'm telling you, I wouldn't tell my mom. I would absolutely not. Don't even say the
Listen,
word to my mom and my sister. Don't do it.
I,
So that's what I think about it. I'm very passionate about it
I
because
couldn't tell. I couldn't tell.
because and the reason why is because it's monetized and weaponized, honestly.
Thank
And
you. Tell it.
I had a personality who I was on her show before. She had, this white guy who's an interventional
I was about to
radiologist, who's
say
just
his
boasting.
name.
He
I'm
was
about to say
boasting
his
and
name.
boasting and doing all of this stuff about UFEs and UAEs and
Yeah.
telling black women he's the
Run.
specialist and all that. You're
Run.
not a healthcare specialist, bro. They're not healthcare specialists. They're not. They do a different type of medicine. So when you have problems from UFE, it's somebody like me that's
Yeah,
going to manage it. They
they're
don't
not gonna
manage
fix
it.
it. They're
They're
not
not
gonna
going to
fix
fix it.
it.
They're not going to do those things. So, and I had an argument online with him or whatever, and the reason, and I try not to do that, but when it comes to your health and misinformation
Yeah.
regarding things that matter to you, I have a problem with that. So
Yeah.
when I get on these forums and I'm able to talk about
Yep.
things like this is where I preach from the mountain, and I don't care who get mad about
Yep.
it or whatever, because nobody see more fibroids than me.
Yep.
Nobody see more patients with fibroids than me to be able to speak on it. And if somebody that does UFE, UAEs, ask them how many fibroids they ever held in their hand.
Yep.
Right? Never. They
And
never performed a fibroid surgery. So it's like, for me, I do this all the time. So, and I see the effects of UFE. Go back on my page. I actually put a picture of what a fibroid looks like after UFE. It's not a pretty thing.
oh
So
my
let me
goodness.
shut up, because I keep
So
talking
no,
about
no,
this
no.
nonsense all
And
day.
I'm only going to add to that because that person you're talking about, I had an interview with that person
Mm-hmm.
where I was brought on as an as an expert,
Mm-hmm.
as someone who's dealt with it myself. So I said the whole premise was, oh, why suffer when you can just have the UFE, UAE? It's a
Right.
silver bullet. Never
Right.
have to suffer again. Don't let anybody tell you that. I had the surgery after I had my 3 myomectomies. I had the C-section, and I did it in order to, quote unquote, again, remember, this is in 2012, right?
Mm-hmm.
I didn't know a Dr. P. I didn't know any of this stuff. And I did it because I was looking for a minimally invasive way of dealing with the fibroids, because when they do the C-section, they're not going to remove the fibroids. The fibroids almost killed my daughter. It was literally, they told me that 21 weeks, fibroids are literally pulling the lifeblood away, boom, boom, boom. So I knew they were there, and a year and a half later, I'm dealing with fibroids again.
Mm-hmm.
Yes, that's him. I'm
Right.
dealing with fibroids again severely. Okay. And they did a hysterectomy, a partial hysterectomy, left my ovaries, and I went into full blown menopause. Left my ovaries though. Why did I go into full blown menopause? The only thing that was different was I had that surgery that cut off the blood supply,
Mm-hmm.
right, through my uterine arteries. So I said that in the interview, and he was so, oh, you're like one of the only cases I've ever heard that had complications. I'm like, you lying. You were lying.
I be lying, man. I be
Lying.
lying. I
I
even dare be lying to the
tried to
people,
be
man. Don't lie to the people.
professional. I
Don't lie to the
tried
people.
to be
I
Dr.
went
P.
in. I went on. Y'all, if y'all could find the post, like I went in, like I was trying to be cool, but he tried to pull it like, and I just went professionally on him,
I
just like,
I said
let's talk
no.
about facts.
Yep.
Let's talk about facts,
Yep. I said, no, I'm not
Um,
the only one because I talk to clients all the time who've had the UFE or the UAE's same name. I say this because people will tell you there's some difference. Uterine artery embolization, uterine fibroid embolization. It's the same
yeah.
procedure. And they have had fibroids come back because the
Yeah.
fibroids don't
Well, they
like,
never go
they
away. They're
never
not
go
going
away.
away. They're not
You
going
still
away.
have to do things with your lifestyle in order to
Facts.
break them down, right? So here's the deal. I want you to know, if you remember, it is completely abnormal to just cut off the blood supply to them. And then it is literally to those however many fibroids, and or they say they do it to the whole uterine artery. That's scarier to your whole
That's even
uterus.
crazy.
That's
That's
scary,
nuts.
right? And the idea that it's a silver bullet, that, oh, I don't know why women are dealing with fibroids. All they ever have to do
Mm.
is and then one told me the only reason they came back was because in order for the UAE to work, you're supposed to do it before having a myomectomy. So you don't have a myomectomy, you do the UAE,
Yeah.
then you never have to worry about fibroids again. Stop it. And the thing that I hate is that they are predators. They are literally preying on Black women. They are going into forums telling
Mhm.
Black women, you don't have to suffer, you're disproportionately affected by this, you're bleeding and you're hemorrhaging, and they're acting like they're offering a solution. See, you
Yeah.
got me on my soapbox now. You
Yeah.
offered
But
a
I mean, we
solution.
be eating that up, man. They don't put me on the stuff. They'll put their ass on there, and I'm just like, okay. And it's just misinformation. It's so aggravating.
So
Somebody
some
asks like, what are my thoughts on like myfembry? Like myfembry is a great drug, but the only downside. And
temporary.
so myfembry is a medication
Hmm.
that is designed to counteract excessive bleeding for
Bleeding.
women with fibroids,
Right.
and it does have
Some
some effects, but
women
it's
need
a
it to
it's
stop the hemorrhaging
right.
while they're trying to find another solution.
It's a
Absolutely.
it's a
It's a
band-aid though,
band-aid,
so
just
it's
like
you can
transexamic acid. That's a
right, so
band-aid.
you can only be on myfembry for up to 2 years. Like after that, you have to come off of
Yeah.
it.
And I
So if it's
and we
if
don't want you on it for 2 years.
right,
Right.
so if it's bridging you over to something, bridging
The
you over to surgery, bridging you
solution,
over to you're pregnant, or
lifestyle
bridging you
change.
over to
Yep.
something,
Yep.
absolutely. But don't look at it as a fix, because it's not going to be a fix long term. It's a bridge, a temporary bridge to get you to something else.
I'm gonna take, somebody said, will they go away after menopause? It really, every case is different. What if your fibroids are driven by chronic stress? All right, not necessarily by hormonal imbalance, but they're really driven by chronic stress. If that chronic stress is driving the acceleration of it, on top of maybe vitamin D deficiency is a big deal thing you're dealing with. There are things that are scientifically connected to the presence of fibroids. There have been studies that show that. Like, you got to look at what your case is connected to. So, do they go away? His studies have shown that some cases they do, some cases
So
they don't.
if you have a 10 centimeter fibroid and you waiting on menopause to make them just disintegrate, it's not gonna happen,
Right.
right? So once they,
You got to have a plan. You have a strategy.
what happens is that in truth, it's not the quote unquote fibroids going away. It's that your symptoms are improving, because with menopause, you have the lack of hormone production coming
Hmm.
from your ovaries. So the
Right.
things that happen with your uterus that are responsive to the hormones are going to improve with menopause, right?
Hmm.
Meaning, bleeding and cramping and those things will improve, but it doesn't mean the fibroid is going away. So if you're somebody that has advanced fibroid disease and you don't just have bleeding or pain from the fibroids, let's say you have frequency of urination, or you have pain
Yeah.
with sex, or you have
Hydronephrosis.
or
Hmm.
other issues or
Hmm.
pain from it, don't count on menopause to just now make your fibroid smaller.
Yeah.
It's just not going. The reduction inside, there is minimal reduction
Mhm.
when you take some of that hormone away, but it does not go from 10 centimeters to zero. It doesn't happen that way. I've
You need a
operated
plan.
on many 55 and older women with fibroids that just can't deal with it anymore, not having periods, not having bleeding, not having cramping, but have these huge fibroids that are just still making their life miserable.
Hmm.
So
Somebody
that's
that
my
you
answer
just
to that.
answered another question, so that's great because somebody just asked about that.
Yeah.
Yes, my
So
Fembry and Orion they do the same thing, but
uh
they're
they shouted him out. They did say his name. Good.
yeah,
Yes,
I
that's
said
him.
that. I
It's
said it.
Dr. Littman. That's him.
That's him.
That's him.
That's him.
Yeah.
Yep. I did an interview with Tamika Mallory, the activist,
Uh-huh.
and she, that was the one. All right. So to wrap it up, you have the links at the bottom. We are in this to really help women end the suffering. We want you to know that you've got people you can trust. That's the bottom line. We're going to tell you the truth. We're going to
Mhm.
tell you the truth. And like you know, we are in it for real. Like I have women there, but I'm praying with them the morning of or whatever. Like we're supporting you for real, right? And going to give you the truth and help you to make the empowered decisions because it is your health. We want to empower you to have the desired outcomes with the decisions that feel right for you, not making decisions
Yeah.
for you. It is your health helping you to make the right decisions for you. All right. Somebody said Mr. Dr. P is a godsend. I agree with you.
I'll try. I'll
I
try.
tell you, but we don't want AI Dr. P. We just got to find a way for you to teach more, put more hands and train more people. What are the statistics that fibroid grew during pregnancy? Oh man, it depends on
So,
the case by
so somebody
case.
asked, like, what are those options for those without insurance? It's expensive for consultations and possible surgery. So that I would say honestly, and this is not even being mean, you got to get insurance.
Mhm.
Like it's you have to trying to pay for any type of, and it's not me, right? People think like, oh, doctors get paid
The
all of this from,
hospital.
no, it's the hospital
Yeah.
from
You got to do it
from
in
every
the
feed,
hospital.
from the OR, all that stuff. You're talking exorbitant amounts, and I am the lowest person on the totem pole as far as getting paid any type of fee. So don't think of it that
OR.
way. But
Mhm.
you're not going to be able to pay for it. You're talking about like 90 to $100,000, like from OR
The
fees.
hospital
Like
room, the
you're not going to do
OR.
that. So if you
Mhm.
do not have insurance, you really need to, you know, get some form of insurance. And I know I can't put money in, I count everybody's pot money or what have you, but paying for an insurance plan and having a plan to do that for a year, and have a strategic plan so you can get your surgery within that year is so much more attainable than actually trying to come up with the actual cost for surgery.
Oh
So,
wow.
and as far as like
Yeah, definitely.
consultation fees, I do try to work with people as far as the consultations and stuff are concerned, but at the same point, at the same token, like consultations, I literally am taking after, like, for instance, today I've been in surgery an entire day. I'm gonna be on call and stuff tomorrow. I take time out of my life from my kids and everything else to talk to you for an hour and a half, however long it is, to answer every single question that you have.
Hmm.
In addition to when you do need surgery, facilitating that when you come and post-op care and all that stuff. So, it's an investment in yourself. At the end of the day, it's a small investment in yourself, for all of the things that I have to do. So, that's my answer to that. But I think,
The
yeah,
other thing is for
yeah.
people who may not have insurance, and there are things for us like these are free resources we give you to help, right? So at the Detox Now, we have a free anti-inflammatory food list. We offer free consultation, group consultations, and support in our support group to know things that you can start doing to even just help with the symptom management, okay?
Mhm.
Because wherever you are, there's something you can do, all right, even while you're trying to get insurance, or you're trying to see how your body's going to respond. Like at the end of the day, we want to make sure something is always available to you. That's why I say start there, because guess what, even if it's just I'm going to change my diet, many people, they have followed and changed our diet, and that was the first step, and started to have so much improvement that it gave them hope to continue on their journey, right? And then someone said, if I don't have symptoms, I don't,
Yeah, I just
I
saw that. I
don't
was going
want,
to answer that.
do I have to? It
Yeah,
really
you
is a
don't. I
personal,
mean,
it's a
I would say,
personal choice. No, you don't.
I would say this. Yes, the rule of thumb is yes. If you're not having symptoms from fibroids, then no, you don't need surgery. Like you could just leave them be. unless you have advanced fibroid disease in which they are very big, they're protruding your abdomen, and it's maybe to the point where your surgical options
Change.
change if they get to the bigger, because realize once you get to a certain point, like options start to change. Like, you know, it's you have to get these large masses out of very small holes. Like it becomes very difficult, you know.
Yeah.
So, you know,
And the
you're
surgery
running.
becomes more difficult
Absolutely.
and becomes more threatening for
Absolutely.
you, more risks associated with you.
Right.
And then the other thing, again, remember I said that if your body is going to be responsive to lifestyle change, I say if you don't have symptoms, give your body the best option. That's why we created our fibroids kit in our program, so that you have tools to help you to start where you are, okay, and then see how your body responds. And if that's the case, and it's at least you can hinder, you know, with growing, or however your body's going to respond. We've seen a lot of different things happen. You have tools, you have options, you have support, but don't do nothing. That's the thing. Don't do nothing. Don't sit there and do nothing. That's what I would recommend. All right. Hey, Kiana. Any other questions that we have here?
I think that's it.
Somebody said she believes the vaccination was a trigger to her fibroids growth.
I'll let you have that one, man. I ain't about to do all that, man. I ain't about to do all that. Well, I'll be in here appreciating. No, ma'am. No, ma'am. No, ma'am. Your
Your
fibroids and that
lifestyle is a
vaccine
bigger
has
trigger
nothing to
than
do.
that.
Has nothing to do with it.
But
Yeah.
I will say this: the pandemic, the chronic stress in the pandemic did cause. I had one of the most stressful years of my life.
Yeah, stress is something.
Everything was on a regular trend, and then I had that year tripled in size. Everything before that, it was real kind of staying the same.
Which is also contributes to Black women's problems too. Like it's
Absolutely
just chronic stress or whatever.
Chronic
so that
stress
does increase to
spirals,
why we have advanced
chronic inflammation. Absolutely. So that versus that vaccination. All right. So Sunila, you asked the same question. I said, take the quiz at the link in our bio at the detoxnow.com/quiz, and you'll get more information there on, you know, what is recommended for you, and you can book a free registrate or for a free consult if you want. I think we're good to go. Thank you so much. Thank you, Dr. P. I will follow.
Thanks for having me, everybody. God bless. Talk to you soon.
Already know. Right. You already know fibroidslayer.com. We need to talk to him about your case. All right.
All right, guys.
All right. Take care.
All right.
All right, everybody. Thank you so much for being with us. We are grateful for the opportunity to just be in your life. We really do. We honor you and we appreciate you. Please know that all we care about is your health being a dream, really being a joy, living an abundant life and abundant health, and that we're doing everything that we can to support you in doing that. So if you're dealing with, I'm going to repeat it, if you're dealing with any of these issues, you want support, guidance, take the quiz at the link in my bio, follow both Dr. P and I, take the quiz at the link in my bio at thedetoxnow.com/quiz. And then also Dr. P is on our page as well, but you can definitely go directly to his website, fibroidslayer.com, to book a consultation with him. But know that what we recommend you do is definitely have the integration of the work that we do together, so that you have the support of both the traditional and the holistic, so the lifestyle support that you need to not just prepare if you are going to do surgery, to prepare for it, help your body prepare for it, and then help on the post-op to heal and to help your body prevent complications in the future. And if you don't want to have surgery and you want support to know what to do with what you're dealing with, again, take the quiz at the link in my bio, register for one of our free group consult options, or free consult options, because we have group and private. And then we will help guide you, support you, and help you live an abundant life. We love you. Goodbye.